Good morning everyone. Today I am going to teach you what is mean by reciprocal inhibition. With that I am going to decode lot of the codex in the body. Okay, let's see one by one. First, we need to understand what is meant by reciprocal inhibition. The word reciprocal inhibition means something will get inhibited reciprocally. What it is inhibited? So that means if you use in the body, for example, any compartment, especially a flexor or extensor, abductor or adductor, the opposite compartment for the muscle will get inhibited in nature. For example, if you do the action in the flexion, the extensor will get inhibited. Likewise, if you do abduction, the adductor muscles will get inhibited. How it is getting inhibited? That is the question. The answer is it innervated like that. The structure itself is innervated like a reciprocal innervation. That means if you take a spinal cord, okay, from there is a nerve roots which is coming out of the spinal cord. How the nerve root will usually come out? It have a two pathways actually. So one is from the anterior and one more is from the posterior. Usually posterior won't give any signals to the limbs because posterior is a sensory pathway. It takes the input from the stimulus. For example, if I am giving any pain stimulus for him, that is the pain sensation which is carried through the posterior side of the spinal cord. It will go and reach the posterior arm of the spinal cord. Likewise, that signal will go to the brain. It will process, and the output which will come through the anterior arm of the spinal cord, that is the motor system. Okay, so whenever it is coming in the anterior, so you need to understand, if you see in anterior, for example C5, C6, C7, C8, there are a lot of nerve roots are there, right? If you take one nerve root for let's say C7, if you take the C7 anterior root, if you go and open the anterior root of the C7, there is a mixed patterns of nerves. It is not only the one nerve. So there are a lot of bunches of neurons will be inside. So in that only one nerve, one kind of like nerve fiber neuron will go to the from the same nerve root, from the same C7, it will go to the flexor. At the same time, from the C7 only, same different neuron, it will go to the extensor. So likewise only, when you activate any muscle, it will inhibit the involuntary actions. For example, if you take radial nerve, so what are all the muscles which is supplied by the radial nerve? Let's say for example, triceps muscle, extensors of the forearm muscle. Now the patient want to do extension of the elbow. Sir, can you able to do extension of the elbow? Now he is doing the extension of the elbow without doing the extension of the wrist. If the triceps is supplied by radial nerve, if the sensation, like if the impulses is carried, if the motor like whatever the commands which is carrying through the radial nerve, it needs to go to the radial nerve also, right? It needs to carry out through the extensors of the forearm also, right? But here it is not going, and he is not extending the fingers, but he is doing only whatever he is voluntarily thinking to do. So this is the arrangement of the motor patterns itself. It is not like this nerve which is innervated means every nerve, every muscles which is supplied by the same nerve have to work. Okay, it is not like that. It is depends on how the brain mapping is signaling. Depends on that what will happen is, for example, you can take like agonist, antagonist. This is the system actually. For example, if you want to do extension of the elbow, at the time he decided to do extension of the elbow, what will happen? The pattern, the flexors of the elbow will get inhibited. Okay, at the same time, if you want to do extension of the elbow, so while this triceps is pulling, this extension should not happen. Okay, only the elbow extension have to happen. So the flexor will get fired. Okay, that is the anterior deltoid. At the same time, if you do not want to do a wrist extension and the finger extension, the flexors muscle will get fired. These are all the motor mapping, that is the blueprint which is coming from the basal ganglion of the brain. So these are all reflexes. So when we are in the child, these are all reflexes. Now it became as a voluntary movement, fine movement. This is called fine. When you go and say for the stroke patients, if you see, it won't be there. That is the difference between us and them. Now you may ask some question now. So this will not only happen between the flexors and the extensors, okay. So the flexors and the extensors are it should not be, or it need not to be the different muscles. For example, flexor is musculocutaneous and extensors are the radial. So you can say this is getting inhibited while this is getting innervated. It is not like this. You can see this is the deltoid muscle, anterior, middle, posterior. This is multipinnate muscle. The muscle fiber itself is arranged to do that function only. If you activate the anterior deltoid, it will do flexion. Likewise abduction, likewise extension. From the same axillary now, okay, same nerve root, there is a both inhibitory as well as excitatory will come. When you want to do the flexion of the shoulder, this will get activate. That means not only the anterior deltoid will get activate, and also clavicular fibers of the pectoralis major, long head of the biceps brachii, coracobrachialis, everything will get activated at the same time, same nerve only, but it will get inhibited because that is the Sherrington's principle, reciprocal innervation. So posterior fibers of the deltoid will get inhibited, the latissimus dorsi will get inhibited, okay, and triceps long head will get inhibited, thereby the movement is happening. At the same time, if you want to do this flexion, okay, if you want to do this flexion, here the extensor will get actually excitated, depends on the, like, based on the Sherrington principle. Yes, if you want to do flexor here, unknowingly here extension will get activated, thereby the body is not falling, okay. If you want to do flexion, the extensor muscles from this pattern, opposite side will get activated, or what will happen, if you try to lift like this, he might fall like this, okay, the opposite muscle will get fire. So this is called cross body innervation. If you want to do any one action in one side, the opposite muscle group for the opposite side will get activated. This is also one more extra point in the reciprocal innervation. So with this concept, I hope you got some information in the reciprocal innervation and the inhibition. If you have any doubt, you can comment here. I will let you know what are all the answers. Okay, until there, take care.